right, hello again, and thanks so much for joining me. I'm Fredricka Whitfield. A mysterious outbreak of Legionnaires disease in New York has now claimed 4 lives in New York City. All of the dead were older individuals with underlying medical issues, but dozens of others have been hospitalized. CNN's Sara Ganim is following the story for us from New York. So this outbreak was first reported last month in the Bronx. What more do we know about it now?
We know it's really affecting that neighborhood here in the Bronx in New York. Fred, investigators, epidemiologists now working to figure out how this began.
Daniel Tejada spent nearly a month in a medically induced coma in a New York hospital because of Legionnaires disease.
I was about to wait one more day to go to the hospital, and if I would have waited that one more day, I don't think I would have been here right now.
The outbreak has caused 65 people to get sick since mid-July. 4, all with pre-existing conditions, died.
The CDC needs to come in this community.
Residents of the South Bronx are calling for more action as health officials say the outbreak could get worse before it gets better.
We think it's very possible that there will be an increase in cases over the next 7 days.
Named after an outbreak in the 70s that made a group of American Legion workers ill, Legionnaires is a respiratory disease with flu-like symptoms. You can't catch it from someone else. The bacteria travels through water mist, like from air conditioners or cooling towers. 5 buildings in the South Bronx have been thoroughly decontaminated, city officials say, in an attempt to contain the spread. Meanwhile, residents are warned to seek help at the first sign of illness.
We thought it was just regular pneumonia. He got sick, but then we found out it was Legionnaires. That's when everybody really got into a panic.
Now, Fred, New York health officials say it's important to remember you can't catch this through the drinking water or swimming pools or fountains. That's an important thing to remember in the summer. There's really no need to panic about that. And in this neighborhood where it's been found in these buildings, they're coming up with a long-term plan for checking these cooling towers to make sure that that bacteria is no longer there for residents in that neighborhood. There's a town hall meeting tomorrow.
Oh, I'm sure they have lots of questions when that happens. Thank you so much, Sara Ganim. Appreciate it in New York. All right, let's find out more about the threat of Legionnaires disease. Dr. Devi Nampiaparampil is an assistant professor at the NYU School of Medicine. Good to see you.
Good to see you too.
Okay, so we just heard that this outbreak is around a cluster of several buildings in the Bronx. What does that tell you about its origins or how people are being exposed to it?
Well, we can't know for sure, but it might be that it's coming from water towers that supply the air conditioning units or other units in those buildings. What's concerning is that it seems to have spread to Lincoln Medical Center, which is a hospital. So you have more sick people who are in that area, and they're going to be more susceptible to catching any type of infection and actually potentially dying from it. So that's very concerning.
And then help us better understand how it is contracted, because, just hearing that there may be sort of flu-like symptoms, as we heard in Sara Ganim's piece, really means anybody is susceptible.
Well, that's true. I mean, your immune system will fight it, so anything that weakens your immune system is going to make you more likely to get it or have more symptoms from it. But generally speaking, the bacteria has to get to your lungs. That's why you have to inhale it, whether it's through water mist, and why you can't get it if you just drink clean water, because it's going to go through your gut. It's not going to go through your lungs unless you choke. So basically, it's got to kind of come in as a sort of mist into your lungs, and then there your immune system can fight it. But if you have a problem with your immune system, then of course it's going to be more likely to infect you.
And then you have a personal experience with this kind of infection. You apparently surviving something similar as a teenager? What happened?
Oh, well, well, not Legionnaires. I had a different problem, but the thing about it is actually once you have these problems, anything affecting the lungs or affecting your immune system, you've got a big problem. So what is critical is that for people who have this, they have to get treatment. So they have to get early antibiotics. Now, I think one of the things here is that people may not realize right away that they're sick, especially because this thing takes 2 to 10 days, anywhere between that period of time, to actually show up as symptoms. So people might think they have cough and cold mild symptoms when they might have, something more serious like Legionnaires. So they should get evaluated. And then aside from the antibiotics, the problems are that if you start having trouble breathing, if you start getting really dehydrated, this thing can affect your whole body. So it's important for people to get also lots of fluids and supportive care.
So how does one protect themselves when you talk about, ingesting or taking in a mist? Are we talking about many of us need to wear masks?
I don't think people need to wear masks, no, but the areas that are, if you're in a high-risk area, then just be aware if you have symptoms. You really can't protect yourself from getting it if you've already been exposed because it takes a while for it to show up. But if you're not in an area like the Bronx, then your risk is low. I mean, people do get Legionnaires in this country. There have been about 2,400 cases is the estimate so far this year, so it does come up. But what's concerning here is that the number of cases in New York, for example, has been going up over time.
Mm-hmm. All right, Dr. Devi Nampiaparampil, thank you so much. Appreciate it.
Oh, nice talking to you.